Every society runs on a kind of fuel. For healthcare, that fuel isn't technology or capital, it's trust. And when trust erodes, data becomes noise, science becomes opinion, and we start mistaking what's loud for what's true. Today, we're living through that fracture. Government agencies struggle to hold the public's confidence. Misinformation spreads faster than any vaccine ever has. And the private market, the one driving our AI tools, our biotech breakthroughs, our digital front doors, is racing ahead of the ethical guardrails meant to keep patients safe. That's not a political statement. It's the reality of a healthcare system that's learning in real time what happens when the engines of innovation outpace the moral code of the system. So today I'm sitting down with one of the clearest moral voices in modern medicine, and someone who's shaped how I think about healthcare more than he probably knows. Dr. Arthur Caplan, founding head of the Division of Medical Ethics at NYU Langone. And we're going to talk about three things that cut to the core: the government's responsibility to be a source of truth in public health, the weaponization of misinformation, and whether social media can ever be an ethical public square, and the line between innovation and exploitation when private capital drives clinical decisions. This isn't an academic debate. It's about who gets to define truth when lives depend upon it. I'm your host, Rick Giannotta, and this is the Healthcare Nation podcast. Let's dig in.
Welcome to the Healthcare Nation podcast. We're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the healthcare sector. Now your host, Rick Giannotta.
Dr. Caplan, great to have you back. I just have to say this. First of all, second time on the show. I wish I could say you've been here like 10 times already because I have that much to cover with you. But look, you're always busy, it seems. And as of late, there's been a bit more of an uptick, I think, with your appearances that I've seen on the media, certainly the past month. And we're going to cover some of those topics today because I think your perspective, your expertise, always enlightening for me, but also I know our viewers are going to love that. So if you're good, how about just jumping in, my friend?
Thank you, Rick. Sure.
All right, fantastic. Look, I wanted to cover three big broad categories today. One, I'll just say the weaponization of misinformation and social media and the ethical kind of boundaries around that, and then talk about private equity and what that means from a care delivery perspective and holding up the patient side of the bargain. But let me start with the source of truth side and the government's role in that. And I can't help but think about what's been happening, and we'll go back obviously a month or so ago with the executive statements on Tylenol by the president and the secretary, and it's linked to autism. And it makes me think about, just generally speaking, executive kind of statements in that office. And is it verse science or weighing in on science? So my question to you is, when you have leaders move, I guess I'll just say, faster than science and outside of the bounds of even what we might consider science, what's the ethical responsibility for separating, that perspective from, I think, someone's just general views on things and the implications of that to the public, particularly when it happens to be the citizens of the country? How do you square that circle, Art?
Well, first of all, what is warranted? What is justified? And there are a lot of ways to get knowledge. Some people have transcendental experiences on mushrooms, and they're pretty sure that they got wisdom out of it about something. There are people who read books, the Bible, that they believe give inerrant truth, and they try to believe in that document. But really, for the culture, if you're not in a religion or you're not in a mushroom club, I think what is the main source of truth is science. It's been true in America for a long time. So there's a pragmatic aspect to what makes truth. Can you act on it and get results? Can you deliver on what you say is so? If I see one more announcement, by the way, about when the rapture is coming, it'll be one more too many, but they failed 1,000 times. That's bad for religion. In science, if you fail 1,000 times, it just says, revise the theory. Come up with a better idea. Another thing that makes science
Arlen,
believable.
can I ask you one question along those lines? For me, it makes it that much more difficult when, yes, I think some of our, let's just say the institutions that we depend upon and have historically thought upon as these are the places which are the sources of truth, the guidelines if you're a clinician, et cetera. And when you have, wholesale change out of leadership there from folks who had been career scientists and folks who really, I think, dedicated their lives, in that space of discovery. And then you have political appointees coming in, and then you have the rank and file, in this case, let's just say clinicians saying, I no longer really believe what's coming out of
Yeah,
the FDA as much as I used to. That's another layer. It's a flipping of that whole narrative now where I don't even want to look at those institutions as necessarily the source of truth they used to be.
yeah, I don't think they are anymore. I think when you have political appointees and vetting messages by political people with no science background, which is a good number of people that RFK Jr. has appointed and Trump has appointed, no credibility, none. I wouldn't go there for much information about anything the federal government in the science space, not on climate, not on pollution, not on vaccines, not on how to deal with autism. A lot of topics would not go there. They don't believe in science. They believe in ideological responses. I want to be free to do what I want, so you take your vaccines when you want to, not because they work or they're safe or they'll save your neighbor. I believe in individual choice, says the Surgeon General of Florida, says RFK Jr., says McCary, the FDA guy. Well, that's nice, but that's an ideology. That's not got anything to do. Science sometimes makes you do things you don't want to do. And by the way, I don't like getting shots either, and I do,
Right.
but there are plenty of things that science tells me, like don't eat candy and don't drink too much, and maybe you shouldn't look at your iPad 24 hours a day. I don't really like doing that, but I believe that they know that these things are not good for you if you do them. So, our authorities have never been jeopardized like they are now. And it's the part of the political polarization, but it's also deliberate. Trump and MAGA see science as an enemy. It doesn't get them where they want to be. They don't like data collection. They've killed off a lot of databases. Remember, this is part of science too. They don't like the unemployment numbers. Get another person to deliver you unemployment numbers. Well, that's hardly science. The science of economics is not get me the right guy to give me the right numbers or numbers I like. I also think they have a religious element that supports them, conservative religion that doesn't really find comfort with science. And they play to that base sometimes. Now, most of religion has had no problem with science for a long time. I mean, granted, it took the Catholic Church about 400 years to accept Galileo, but okay, they got there eventually. And evolution has not been a problem for most religions around the world. They sort of live side by side. Here's a story from the Bible, here's a story from Darwin, but not this crowd. So you might then ask me, well, if you can't trust the feds, and by the way, I think federal science, NIH, FDA, DOE, Department of Energy, they have an obligation to be conservative, not just tell us the science, but until it's really proven, don't give out advice. They're going in the other direction. I saw a study somewhere in a weirdo journal from someplace I never heard of that says Tylenol causes autism. Hey, Tylenol causes autism. It's like, wait a minute, you gotta get 30 papers that show causation, not some fruit ball somewhere who looked at 10 people who took Tylenol and saw an association, not causation. So you want to be conservative. Medicine is conservative inherently. It doesn't jump to the latest fad. Maha, what Kennedy likes, is fad of the day. It takes these supplements. I like to take this particular non-fluoride filled beverage, whatever. It's going day by day to the latest fad. Science at the federal level, you want it to be cautious, conservative, totally evidence based, pragmatic in that it shows it either something causes harm or something does you benefit. And the administration's thrown that out the window. So I don't trust it.
Yeah, but Arthur, let me ask you, how do we, again, I was saying, how do we square this circle? And when you think about, and I'm putting clinicians in this box as well, who are looking at things like, well, what if I prescribe this? What if I, go down this? Will I be supported? Will I, comport with guidelines? Are things going to change? I put that all together, both patients, clinicians, and even consumers, because this discordance has created such confusion. Again, docs on one side, now agencies on the other, patients caught in between. Is there got to be some level of evidence threshold? Should there be, or some external way before something like this announcement goes out?
Yes.
I know that the president can say whatever he wants, but
And does say whatever he wants, including awfully loony statements, but yes,
yeah,
yes.
is there an ethical standard for changing guidance publicly? That's one question. But the second thing I really wanted to ask you was, have you seen in all your studies anything like this before in the, let's just say, the history of the United States, where there was that kind of juxtaposing or contradictory messaging?
No. The only place I've seen it before is in the old Soviet Union. Joe Stalin had a favorite scientist by the name of Trofim Lysenko. And Lysenko went to him and said, I know how to grow wheat and corn in bitter cold Siberia. And my theories are that the environment can modify plants over generations to make them more cold friendly. Now, there is part of truth in that in genetics. You select out the plants that don't do well in the cold, you can sort of tip the crop of seeds toward those that are more resistant. But what Lysenko was saying is, I can do this in one generation. And Stalin loved to hear that because he wanted a revolution. He wanted to change everything in Russia in one generation. So he made him the chief scientist. Somewhere around the 80 millionth person to die of starvation, they decided maybe Lysenko wasn't their guy anymore. So, yeah, I've seen it in Germany. Nazi Germany had it where they just said, these theories, a lot of them are Jewish scientists, Jewish physics. We're not going to follow that. We got the atomic bomb first because they didn't want to do physics that they thought was tainted by Jewish thinking, let's put it that way. Also, in areas like anthropology and genetics, they had all these theories about inferior races, about people who were prone to alcoholism, prostitution, laziness. And they believed those theories because it fit their view of why they had to eliminate inferior people. And I'm sad to say the resurrection of that is Donald Trump when he talks about immigrants. Dirty, bring us disease, going to replace us. You probably heard the Great Replacement Theory. That's the old German racist biology. So I'm seeing that back here, but I haven't really seen it before here, not here.
So, picking up on that, and if I could just overlay that on what I guess would be American perceptions, I think it's like in the low 20% of Americans trusting the federal government right now, with which I guess in the health world, for being the accurate source of any kind of information. And if that's the case, how does, and we're going to get to the social media, question next, but where do you go from that? I mean, is it just, what happens?
So I have some ideas about that. If you're lucky enough to have a doctor, and some Americans don't, sadly, but if you do, you go there first because the doctors are getting information from their medical association, from their peers. They go to medical meetings, and they're usually pretty up to date on what the journals are saying about the latest news in their area. So I would ask my doctor first. I wouldn't ask RFK Jr. I wouldn't ask Donald Trump. I would say to my doc or pediatrician or gynecologist in the case of Tylenol, what do you think about Tylenol? And what they're going to tell you is Tylenol's been a suspect for autism for 10 years. No one's found any proof. The fact that it got trotted out at that press announcement is ridiculous. And what it treats is fevers. And what we do know is that fevers kill fetuses. The mom gets sick. High fevers cause miscarriages. We know it. And by the way, Dr. Oz was in the back of that press conference and he was nodding away. He learned in the first year of med school, fevers are really bad. Tylenol, whatever its risk, and my answer to how much risk would be nothing, but maybe everything has a teeny risk. But whatever it is, you don't want to have a fever when you're in the first trimester of pregnancy. So, second, after you talk to your doc, go online to trusted sources. Who are they? They are the professional medical groups. Just go on and say, Google, take me to the American Medical Association, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the American Psychiatric Association. They all have autism websites, to use that example. They're pretty good, easy to read, tell you why they think the federal guys were wrong, flat out wrong, and what you should do. And look, we ignore one fact. Moms want to protect their babies. It's not a bad ethical desire, so they're listening what would be risky. On the other hand, when the president says, you have a fever, you should suck it up. Suck it up. I mean, come on now. That's morally repugnant because, A, it's telling a woman bad advice. You want to protect your baby. Don't suck up a fever. And, he's blaming women for autism because they're all thinking, gee, I took Tylenol. 50% of Americans have. 50%. Did I harm my baby? Is that what happened? Because I don't really know why, they're autistic or whatever. Really ethically disgusting. Third, what do? You can look at websites and information from overseas. Canada, Britain, Switzerland. They all have their the health minister of Britain was on within, I think, 4 seconds saying, this is all nonsense. This autism Tylenol business, do not listen to this. It's stupid. It doesn't have any evidence. It's dangerous. And those, I think, can be checked. And that takes us to the last thing. Do not get advice from social media about health, ever. I mean, general social media. I mean, just Twitter X and TikTok and whatever other sites are floating around out there for health. No. Movies? Maybe.
On the social media side, I just got to jump on that. I think there was a stat I saw that there's an estimation that misinformation now spreads 6 times faster than factual content in a public health crisis in social media, and that TikTok searches for a natural cancer cure and vaccine detox rose more than 400% in the last quarter of 2024. So how do we,
we can do this while you're listening. Google vaccines. I think the top 10 sites that come up are anti-vaccine sites. And the people who don't like vaccines know that, and they spend a lot of time visiting their own sites to boost them up through hits in what shows up first in the search engines. Science isn't very good, sadly, at getting into public communication. We all know during COVID, we saw scientist Tony Fauci, who's been demonized for it, but was out there. And we have maybe other names like Peter Hotez, Paul Offit. Some people saw me and, giving messages about what to do, get your shots, wear a mask, don't go to school, stay home, don't sneeze on one another, all this sort of stuff. Not always messages that people wanted to hear, but they did it. But there were very few of those people. I mean, for every one of those, there must have been 1,000 social media people up there saying, if I were you, I would take ivermectin and I would take hydrochloroquine and I might swallow some bleach and I would lay out in the sun because that kills COVID, and on and on and on and on. Science got outgunned, totally outgunned. One other thing, where science also fails is that a lot of these battles are won at the local level. Yeah, social media, but also who's at the high school, who's at the church, who's at the 4-H club, who's giving a talk for the boys club or Kiwanis or the Rotary. And it usually isn't the scientists. It's usually some housewife who was on social media and has an interesting view about why something's happening. So I think science has to get out to the local level, do more talk there. You win a lot of those battles locally.
Arthur, let me ask you, there's a generational reality here, though. I think like 70% of Gen Zs and about the same number for millennials, in a study, I thought they're using social media for their health advice, and over a quarter of them act on the information that they find there. So if this next generation, right, that's coming online, literally, start their health journey by going on TikTok or
Yeah.
Instagram before they ever see a clinician, what does ethical public, response, communication, and I would even say education look like now, given that just generational swell?
Well, I wish we would put more health and wellness information into our elementary and secondary schools, because you want to get people thinking about where to go and how to think and what to criticize and what to watch out for early. And we don't. I think another important thing is demonstrate things like what's in my school lunch and why is it there? And do we grow vegetables anywhere around the school if it's climate possible to do that? And why do we do? In other words, learn about your health and your wellness at basic levels. You don't have
Make it
to
real. Yeah, make it real for them.
Yes, you don't have to learn immunology in the 6th grade. Why is it that whole plant food is something we're trying to push in the school cafeteria, and what do we know about that? And if you grow it, you can see what chemicals are used or not used, and uh, question it or say whatever you want. I'm not saying everybody then has to become a vegetarian. By the way, I'm not. I think I should be, but not quite there. But um, you learn in a practical, everyday sense. Similarly, we could build it into sports. Why do people get concussions? What about power drinks? What do you do? What's a good training regimen? Would you take steroids? Why not? Use what their experience is early. Short of, that hope for ideal transformation someday, I'd say, I'm going to say 3 things. One, if it's endorsed by a celebrity, don't trust it. Why are they using a celebrity?
Mhm.
It's because they don't really trust the medicine or the regimen or the
Yeah.
diet. They think you're going to trust the spokesperson. And I don't know whether it's The Rock or, you know, Doja Cat or Taylor Swift or whoever. I don't care about their views about health and wellness. By the way, most of what you see from our celebrities is pretend, because they're all undergoing cosmetic surgery,
Mhm.
huge amounts of makeup. They have their own trainer who
They
comes
have their
every
own trainer,
day.
their own chef.
Like, what are you
Right.
talking about? They're not stressed because they have 5 people to help them raise their kids. Um, so, in any event, see a celebrity, run away. Second bit of advice, if you see something recommended that you do or take, I would then try to check it out on by going to other web sources. What else is said about the 7-day hot dog diet, or the I'm shredded by staying on the broccoli only diet. You watch things like the Paleolithic diet.
Hmm.
People got into, well, we got to eat a lot of meat and meat and meat and meat. And it turned out it was bad for your kidneys, it's bad for the planet, and it's probably not particularly good for you, because actually Paleolithic people didn't just eat meat. So the whole thing was, but you could see it getting debunked if you just pushed a little further on that particular approach. The other thing I would say about, I go to the web or the internet first, to get my information is, come on, scientists, let's recognize that and let's get out there more. I like to see more legit debunking and tweeting. I know scientists are going to say and doctors are going to say, I don't have time. Just don't have time to do that. Here's what I would say. Ethically, professional responsibility, once a month, go online, correct something. That's fine. There are a lot of nurses and doctors and scientists. Everybody did it once a month. You could have a real impact.
Arthur, I like that. And along those lines, do you think let's just think about the social media platforms. Should they carry some kind of legal or moral liability for any, misinformation? That's number one. And number two, should there be a caveat that's even like, here's another point of view, something like that built in?
Yeah.
Now, I know in the world of free speech, and we hear a lot about that lately, I could see folks saying, no, I'm entitled to my own opinion. Maybe yes, but not necessarily your own facts. And that's kind of where
I like free speech. I'm not in favor even of censoring people who don't like Charlie Kirk or say stupid things about, anti-Semitism or whatever. I mean, I get the no fire in a theater kind of restrictions. You don't want to cause deliberate panic and harm. But it's so hard to control speech anyway, not just according to whose standards, but just in general on the internet. They can't, the internet gets hacked about once every 32 seconds. I don't know that you could actually regulate it in any serious way anyway, not to count for the dark web and all the rest of it. So I think better for this is we need a tougher Federal Trade Commission to follow up claims. Say, how do you know that vitamin BX will cure your autism? You said it on here. Stem cell therapies, they're really good to stop Alzheimer's. I see that all the time. Really? Who's better? Where are they? Show me somebody. This will cure your cancer. The only place people talk about that is when they go to somebody's funeral. Guess it didn't. But we don't see the regulatory agencies correcting completely unsubstantiated claims. By the way, that lets me mention, in addition to celebrities, you know what else you got to be very wary of? Testimonials.
right.
I, Rick, tell you, there's one, let me change that. There's a commercial on for medicine that says it will help you maintain your memory. And they have an old guy who's a pharmacist who comes on and says, I take this and it's made from jellyfish extract. Really happy to take it. It's helped me out. First of all, I'm looking at it thinking, where is that guy, the pharmacist? Because I don't think I want to be going there. But secondly, testimonials don't prove anything. He doesn't know how fast he was losing his memory. Maybe he was and maybe he wasn't. And there's no confirmation, much less a diagnosis. So all this stuff, even silly stuff like keep yourself mentally going by playing Sudoku or doing crosswords. There's no data for that. Now, if you like it, great. But
right. And the scientific side is an N of one. So there's no power. But Art, along those lines, from an ethics standpoint, what's the line between responsible correction and censorship? Like, when does defending the truth become paternalism?
part of defending the truth is to give it a value spin. You could call that paternalism, but I would call it experience. And if somebody has done 100 knee replacements and says to me, you're a bad candidate because you're a little too heavy, you got to lose some weight. Now I can do it, but I don't think the outcome will be as good. Sounds paternalistic. He's telling me but he's not. He's telling me from what I know as an expert. How many people think that if you get a recommendation about how to build a house from an architect, it's paternalistic? Do you think it's paternalistic for the lawyer to tell you how to make up your will? Do I think it's paternalistic if some media person like you says to me, well, I'd present my ideas more briefly, or you should gesture more, or whatever, to be a more effective? In other words, expertise and experience come with a kind of, I want to do what's best for you, and I'm going to give you a value spin. You don't just say, hey, here's a choice. You could take proven treatments for breast cancer, or you can take what Gwyneth Paltrow has up there. Up to you. Here's, one side, here's the other side. I don't want a doctor like that. I want a doctor that says, I favor this, and here's why. Never saw anybody get better from Gwyneth Paltrow's nostrums, but I have seen people get better in my own clinic or from the people I work with. So paternalism is when you're telling people what you think they ought to do because you have better values. Expertise and experience is telling people what to do because you have data.
Big distinction.
Big
Big
distinction.
Listen, I want to, so much of this, I think, and this may be stretching it, is driven by certainly social media. When I think about what's happening with just the capital markets and the money and the flow of money, and going from this world of first, I want your attention, certainly in social media, now to one that is more like, I want your intimacy as well. And of course, I mean, intimacy in every way, including what's your credit score, your financial perspective, what are you eating at Whole Foods? Can I build a digital avatar? And maybe, from a risk perspective, actuarially hedge this so that I can have a big margin. And by the way, full disclosure, I'm a free market person. I really believe in innovation and creativity. But this is an area I'm really interested in. I've wanted to ask you about this kind of profit paradox when you think about, and I'll just take a good healthcare example. You look at private equity owning and operating, a chunk, a large percentage, I think over 10% of US hospitals, and well over that, maybe 30% of physician practices. And in fact, some insurers are the biggest physician employers in the country. Can healthcare innovation driven by profit, because these for-profit companies, they have an obligation, return on investment, right, to their shareholders. Can they ever be ethically neutral, or does the profit motive inherently distort that? I mean, this is just something, even with ESG and everything else we've seen. I mean, what's your thoughts on that? And I say that knowing that I think the market was over 46,000, this morning, and we're seeing record highs, and it's just something that I think is a real, certainly for me, top of mind subject.
So here's a question. Who would you say is the founder of modern capitalism?
The founder of modern capital?
Yeah.
Wow. I'll tell you, you're testing me, but please school me on that,
Adam
Arthur.
Smith, The Wealth of Nations.
Right.
Really laid out the principles of markets, capitalism, why he felt the invisible hand was a good way to resolve social issues that they would sort out eventually by the market forces. What people forget is he wrote a book before that on moral sympathies. He wrote a book about the fact that ethics is essential for markets. You cannot just have a raw, free-for-all, cutthroat market, because that falls apart. People don't trust one another. They won't honor their contracts. They don't honor their promises. They can't trust the information that you give them in order to invest. If you don't have the theory of moral sentiments, as he called it. Now, when Milton Friedman came along, a modern hero to many of our capitalists, he dropped the ethics part. I think that was a huge mistake. So I'd begin there saying, if you don't have an ethical infrastructure, in basic ways, tell the truth, make sure that your audit is honest, make sure that you disclose where you're investing. If you have insider information, it's not fair. You can't do that. I mean, a lot of insider trading out there. I would even say that market is laden with it now. I know about this. Why? Because in my field, I get a ton of tips about what drugs are coming through that are going to be good. And no, you can't, audience, call me and find out. But I never use them because I know it's insider. I mean, somebody says, give us ethics advice on this trial. And I'm looking and thinking, this thing is really going somewhere. It's going to be good. But there are plenty of people who get that info and use it. And, again, without the ethics, It's not a fair playing field. It's not something you need trust in order to have capitalism. You just can't run it for if it'll collapse on itself. I think also I'm a little bothered in our markets about inheritance. Why do my kids get the money that I made? And you can see some billionaires, the Gateses and the Buffetts, sort of saying, I'm going to leave them enough money so they're okay, but I'm not leaving them whatever it is, $86 gazillion. And I don't think the laws should permit that. Old capitalists, John Locke was another one, a buddy of Adam Smith's, inheritance tax, you have a minimum that you can do, but you don't get to be the third generation of Rockefellers and Kennedys and Walmart fortune people. What did you do? You did nothing. You inherited it. That's not merit. That's not prudence. That's nothing. So I don't think that's honest capitalism. I would not allow that. I mean, put the money into a foundation. Another comment on markets. Markets in healthcare stink. They can't work. They've never worked here. I'm not sure any other country has magic bullet solutions. I mean, people point to Canada, but they get huge waiting lists. They're underfunded. The British National Health Service, government run and sponsored, underfunded. Maybe Germany kind of doing a little better. But in any event, why not here and what's wrong? First of all, the poor and the sick, nobody wants to insure them. Why would I take somebody who's born with a chronic illness and take them in my plan? And I don't. And the insurance company will do anything it can to get rid of those people. They're high. It's like saying, I'm going to insure naval commerce. If you have a leaky ship and a drunk captain, come on in here and we'll insure. Nobody's taking that guy. So risk is not evenly distributed with need. Secondly, a lot of healthcare is not insurance. You know what it is? It's a benefit that you have to buy. Everybody, if you live long enough, will need a nursing home. You don't insure that. You pay a premium to make sure that it's there when you get there. How does profit square up with that? Well, it doesn't square up very well if, again, you can predict who's going to get Alzheimer's and who's frail and who has bad habits. You just don't want them. So you can't have an equity insurance, I think, equity insurance market. Where you can have private markets in healthcare is certainly on the stuff that's elective. You want cosmetic surgery and equity wants to buy up the clinic that gives you that. You want LASIK because you want a little better vision. Great. Let dermatology, you don't like your aging spots, have a ball, buy your way in, compete. Good luck. But if you're saying something like for children who are born with a genetic disease like spina bifida, who need wheelchairs and disability help, that's not a private market. I'm not sure whether it's a premium on all of us to cover that or whether we have to have some sort of, I guess I would call it universal access insurance that the government subsidizes because it's paying for known risk. I don't know. But it's just a crummy area for markets. And I, too, am not anti-market. You want to have a beer industry, I don't care. You want to have a underwear industry, I don't think anybody's going to be dead if you make crummy underwear. You sort of avoid it after time. But healthcare is so weird because everybody needs it. A lot of people have way out of proportion needs. There are a lot of people who can't pay their way through because they're too young or retired or demented or mentally ill or something. So they can't even play in the market space. Somebody's got to take care of them. And then, as I said, need and the need for service is for some things inevitable. I mean, sorry, wellness people, but I've learned something. Everybody gets frail. Worse, everybody dies. I don't care how many supplements you take.
Yeah, there's a finite number of heartbeats. Arthur, along those lines, I have to tell you, I work with a lot of startups, and I really sincerely believe, at least from my perspective, that so much of the innovation that is necessary for healthcare is coming out of the private side of things. And tech is influencing all of those. one of the parts of this, when I might, engage someone and they want my opinions on clinical validation, one of the disappointing perspectives I have had to add is, look, you've got a great idea. This could be revolutionary. But have you thought through how someone's going to pay for this? Because there's no economic structure
Right.
that is going to,
Right.
you know,
I mean, we got a bunch of models out there. There's something called gene therapy where we can now tweak genes, alter genes, in fact, alter many genes with newer technology and repair things like sickle cell, Tay-Sachs disease, cystic fibrosis, probably juvenile diabetes, many terrible, bad hemophilia, life-threatening diseases. But the cost of the technology right now, innovative as it is, it's in the hundreds of thousands of dollars per intervention. No model can sustain that. So you either subsidize it or you say up front, this is a rich man's treatment. It's not in your basic package and you ain't getting it.
Yeah, and at the same time, the institutions we started the podcast thinking about, let's just say the NIH, CDC, where government really had a responsibility for the moonshots, they're no longer, in that same position
Yeah.
for a number of different reasons.
Yeah.
So it leaves a big hole in that space.
You know where I think I've been disappointed about innovation is in areas like home care and the use of AI. I think there's room for robots. I think there's room for companion avatars. I think lonely people appreciate interactions, whether they're actual humans or maybe not. I think telemedicine has a role to play, but I'm not impressed with the way it's unfolding. What I see more of is, are you worried about your sex life? Go online. We'll get you some Viagra. It's a 30-second survey. By the way, I did it to test it. Within 30 seconds, I had as much Viagra being sent to my house as any male could ever use on a harem.
It's the straight up consumer model,
Right.
right? When you think about it.
Where you need it, elderly, home care, make nursing homes more responsive to safety and falls. The market isn't dragged over there because they don't see the consumers able to buy. So that is almost what we call in the medicine side a translational problem. You can't get the innovation over to where I think it would have the biggest bang for the buck. I'm not worried that people are, middle class people are going without their baldness treatment and sex pills. They'll work it out. It'll be fine. But there's so many areas where we could use it. I'll give you one other stupid one. Just transporting people to healthcare. You call for an ambulance, it costs, I don't know, $2 trillion. Try taking an air ambulance somewhere.
Oh, I did that for many years ago.
Did you?
That's
yeah.
right.
Well,
Yeah.
I'm surprised you're not digging coal in West Virginia as a result to still make some money back because off the chart. But I mean, can't we innovate in those spaces? Make it cheaper, automated Uber? I don't know, something. Anyway,
Yeah.
you know where I'm going here.
Arthur, one last question to bring it home. And, I'm going to go back to even my roots as a clinician and thinking about my time with patients and just a lot of the issues we come across that were highly loaded propositions every day clinically. But I think more and more about moral injury. And I don't know if it's applicable in this case, but when you see this kind of, whether we call it misinformation that's on social media or trust in the institutions we had. And if you're a clinician and you're trying to, again, reconcile that and do the right thing, but you're in an environment where, wow, things have changed so much. I may be putting myself at risk or even legal exposure. How do we reconcile that for the folks who are out there who want to do the right thing, the clinicians who are at the bedside, the physicians, the nurses, and even the hospital CEOs who are there and the other folks who are trying to move what I would say is an imperfect system forward?
Yeah, that's a really tough question. Might even be the subject of a whole other show. First of all, I don't like it when the health systems make announcements like, we're going to have yoga at 6. If you're feeling stressed or overwhelmed, then they kind of hint at moral injury, being asked to do things you don't like. We'll have mindfulness at 11, yoga at 6. I mean, I'm not against those things too,
Might as well be passing out Xanax, right?
really. And it's not solving the problem. You're going to be in these sessions for the rest of your career. And I'm not sure, I'm sure some people benefit. There's some data for that. But it is not the answer to the resolution of the dilemma. It's a Band-Aid. So I don't like that as much. I'm not, again, just to be clear, I'm not against it. I think supporting people who are stressed is okay. That's something we try to do, but let's get at the stress. Secondly, I try to urge people to do what they think is right for the patients. If you're facing a coding situation with an insurance company and you think, if I just upcode this a little bit, I could get them the benefit, I do it. Is it fraud? Well, that's on the edge. But would I go to court and say, I did this because I thought it was what my patient needed and it was the best medicine or the best whatever, wheelchair. I didn't think waiting another year for this kid would make them better off. My ultimate duty is to do what's best for my patients, and that's how I sleep pretty good at night because I follow that. Third, we do have to go after the sources of the moral injury. So if you're being asked to spend 12 minutes per patient on a scheme of, management efficiency, and you can't, I'm sometimes laughing. At one end, we have ethics guys like me. When you see the patient, here's what I want you to do. Talk about gun safety. Why don't you ask them if they get all their vaccines? Talk to them about their drinking. How's their sex life? Why don't you inquire about their driving habits? Do you think they wear a helmet when they ride a bike? Do you think they're taking their prescriptions the way you ordered them to do it? Are they doing it every day at noon or whatever it is? These poor guys, ladies, what do they got? 12 minutes? I mean, they're going to say something. What's your problem? Oh, you got to, your elbow's killing you. Let's maybe order an x-ray and make some motions for me and let's see. Oh, bye. I mean, they're not doing these. The only place they go on is in that equity side, the boutique practices,
Right.
The bourgeois or bougie sort of primary care stuff. So we got to fix that. I mean, everybody knows it's wrong. You can't do medicine. You can make money more, but you can't do good medicine with 10-minute visits, and that makes people really feel injured. Plus, like I said, the people sitting in their armchairs are like, well, why don't you bring up, tell them they should support legislation that prohibits Medicaid cuts. And why don't you ask them what their kids eating for school lunch? They don't have time at all to get anywhere near any of that stuff.
Literally the time. Yeah, and you know this. It's the electronic health record and the push to have volume come through and the
Coding
value
and notes and
the coding. Yeah.
any system where you have to hire a medical scribe to work with you is a system that is not really efficient. That's not doing the job. Hey, I'm going to give you one last food for thought thing about wellness.
Please.
So again, I am not anti-wellness. I think medicine does know the keys to wellness. They're simple. Get enough sleep, exercise, eat modestly, drink modestly, don't abuse drugs, wear helmets when you're operating vehicles. It's a pretty short list. The problem is boring as hell. And it's also sometimes a little bit hard to achieve. When you're pursuing wellness on the internet, you're pursuing stuff at the margins. I mean, it's the sort of thing somebody says, well, I took these supplements and I think it added 6 months to my life. Okay, but if you're becoming demented, I don't know that you want that 6 months, but let me give you another example. Run every day for an hour. Okay, I do believe that will maximize your fitness. But for every hour you're running, you're only adding an hour for your extended life. So it's a wash. Unless you like running, all you're doing is torturing yourself and you're not actually getting more value time back. It's a kind of what they call Pareto optimal situation. You can't really, a lot of the wellness behavior, if you don't like it, doing it, then you're just wasting time now to gain the same amount of time later. And in some ways, it's better now because you're more able to enjoy it anyway. So I don't know that I want to run every day for an hour. I'll do my 30 minutes 3 times a week, but every day for an hour, or ultra marathons and stuff like that, you're going to say, well, I tacked on an additional year and a half of life when I was 78. Okay. Since I'm almost 78, I can tell you, take the benefit at 30.
Right. And Arthur, I will tell you, it's like anything in the extremes, right? I want to get away from what's bothering me, so I go deep in the pleasures. I'm so deep in the pleasures, I forget about doing business,
Yeah.
right? It's the same thing. Well, my friend, on that note, as always, fantastic conversation, interesting, deep. I mean, more food for thought than I can eat in a week. But the good news is it gives me an opportunity to have you back.
Very good.
All right. Thank you so much, Dr. Caplan. Great to see you and looking forward to connecting again.
See you soon.
The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.